Hi everyone, my name is Olivia McGann, and today I will be discussing two natural products in the relief of symptoms of IBS. The digestive system is composed of the GI tract, liver, pancreas, and gallbladder. There are several digestive diseases such as gastritis, gastroparesis, lactose intolerance, etc. According to the NIH, 60 to 70 million people are affected by digestive diseases, and it costs approximately $141.8 billion per year. It's most common in females and those 65 and older. IBS is defined as a condition that affects the lower GI tract with unexplained abdominal discomfort causing changes in bowel habits. It's the most common GI condition diagnosed by gastroenterologists. 10 to 20% of the U.S. population has IBS. There are different subtypes of IBS, including IBS-C, IBS-D, mixed IBS, or unsubtyped IBS. Signs and symptoms include abdominal discomfort, GI stress, gas, bloating, diarrhea, or constipation, and medical treatment can include stool softeners, fiber supplements, laxatives, serotonin reuptake inhibitors, and antispasmodic agents. Globally, the prevalence of IBS is 10 to 25% of the population, with the highest prevalence in South America. It's most prevalent in females, and it's chronic, diagnosed before the age of 35 in 50% of cases. Those with IBS are more frequently to miss school and work, resulting in decreased productivity, increased health care costs, increased depression, anxiety, and decreased quality of life. Here is the worldwide prevalence of IBS, and those that are in black have the highest prevalence of IBS. Like the pathophysiology of many diseases, the pathophysiology of IBS is still not entirely known. However, several different factors and mechanisms, like seen in this picture, are thought to lead to the development of IBS and may vary from patient to patient. Because stimulation of the GI tract results from receptors and sensory nerve signals being transmitted to the brain and spinal cord, IBS may result in altered brain regulation, dysregulation within the autonomic nervous system, and impaired brain-gut communication, resulting in visceral hypersensitivity, abdominal pain, and altered gut motility. IBS may also be explained by microinflammation or intestinal infections result in cytokine production, resulting in a change in the gut microbiome. The pathophysiology can also be a result of dysregulation of serotonin concentrations from psychosocial stress. Low serotonin results in the slow-moving gut, which can cause constipation, and high serotonin increases peristalsis, leading to diarrhea. Lastly, genetics may play a role, but it's still not entirely known what gene is involved in contributing to IBS. Probiotics are defined as live and beneficial bacteria or yeast that contribute to the health and stability of the gut microbiome. They're used in a variety of conditions besides IBS, including IBD, diarrhea, constipation, eczema, and UTIs. In IBS, specifically, probiotics have anti-inflammatory properties to improve microinflammation by shifting the cytokine production from pro-inflammatory cytokine IL-12 to the anti-inflammatory cytokine IL-10. In addition, probiotics strengthen intestinal mucosa by decreasing growth and binding of pathogenic bacteria, improving epithelial barrier function, and altering host immune activities. Lastly, the DNA of probiotics also helps to prevent apoptosis of epithelial cells. In the first study, 105 male and female adults with a mean age of 43.3 presenting with IBS symptoms based on Rome 3 criteria and had a diagnosis of celiac disease were included, as IBS occurs in about 30% of people with celiac. It was 14 weeks total, and 52 participants were assigned to the probiotic pill composed of 5 different strains of bacteria, and 53 were assigned to the placebo. Every 2 weeks, participants filled out 4 different types of surveys, including the IBS SSS, which measured severity of IBS symptoms, the GSRS, which measured severity of GI symptoms, the Bristol Stool Scale, which measured stool frequency and consistency, and the IBS QOL, which measured how IBS interferes with quality of life. Results showed scores from the baseline to follow-up decreased significantly in the probiotic compared to the placebo group for IBS, SSS, and GSRS questionnaires. Overall, treatment success was higher in the probiotic group. However, it's important to note no change between the groups in quality of life were noted. Limitations include a small sample size and subjective data collection. The next study included 170 females between 18 to 70 years old meeting the Rome criteria for IBS-D. The study was 10 weeks total. Participants received either the placebo or probiotic pill twice daily for 8 weeks. Bio 25 was the probiotic used and contained 11 different bacterial strains. The Bristol Stool Scale and the Visual Analog Scale were also used to measure IBS symptoms and stool consistency and frequency daily. In addition, to measure intestinal inflammation, CRP levels were measured at weeks 1, 4, and 8, and fecal calprotectin levels were measured at baseline and week 8. Results showed abdominal pain, bloating, stool frequency, and consistency improved in both groups, but no statistically significant improvements were detected between groups. CRP and the fecal calprotectin levels did not change significantly from baseline to week 8 between the groups. Overall, in terms of improving IBS-D symptoms and inflammation markers, though it improved symptoms compared to baseline, the probiotic was not shown to be more effective compared to the placebo. Limitations included the results can only be generalized to women with IBS-D, and there was a small sample size. The last study on probiotics was completed on a total of 49 males and females aged 19 to 75 with IBS according to the Rome 3 criteria. It was 6 weeks total, and for 4 weeks participants received either the probiotic or placebo pill twice daily. The probiotic group consumed the Lactline Gold probiotic, which contains 6 different bacterial strains. Measurements included analysis of fecal stool samples at baseline in week 4, an IBS symptom questionnaire measured at baseline in week 4, and measurement of overall global relief of symptoms measured at week 4. Results showed a significant improvement in overall relief of symptoms in the probiotic compared to the placebo group. Specifically, the probiotic group had a statistically significant improvement in abdominal pain, abdominal discomfort, and abdominal bloating. Also, there was improvement in the gut microflora detected at week 3 in 3 of the 6 strains in the probiotic group. Limitations included a small sample size and a short study duration. No adverse effects were reported. Overall, probiotics are safe and no adverse events or effects were reported in any of the studies. However, there's no clear consensus on a specific combination, strain, or species as most effective in the relief of IBS symptoms. In addition, concerns throughout all the trials included all use different strains of bacteria, the duration of probiotic use varied, as well as the dosage varied, and symptoms improved, but quality of life improvements was only measured in one study and did not improve. Peppermint oil has been used for health purposes for thousands of years, especially in Greece, Rome, and Egypt. It's a cross between watermint and spearmint. It's used as a dietary supplement, most common for digestive issues, common colds, muscle and headaches, and skin conditions. It's available as a capsule, liquid solution, or liquid extract. Peppermint oil contains menthol, which is thought to relax the GI smooth muscles by blocking calcium channels in the gut to decrease GI symptoms. In the first peppermint oil study, a total of 71 males and females between 18 to 60 years old with moderate to severe cases of IBS-M or IBS-D were included. It was 7 weeks total, and for 4 weeks, participants received 180 milligrams of peppermint oil, which was released into the small intestine over a 4-hour period, or the placebo, 3 times daily. Measurement tools included the TISS, known as the total IBS symptom score, and on a scale of 0 to 4 to measure abdominal pain and intensity, abdominal bloating and distension, pain at evacuation, urgency of bowel movements, constipation, diarrhea, gas and mucus, and sense of incomplete evacuation. The primary goal of the study was to measure the change from baseline in the total IBS symptom scores after 4 weeks of treatment. Overall, statistically significant improvements in symptoms were found in the peppermint oil group compared to the control from baseline to 4 weeks, and as quick as baseline to 24 hours. Improvements were seen. Overall, the peppermint oil designed pill released into the small intestine is safe and effective in relieving IBS symptoms. Limitations included a small sample size, short duration, limited system assessment, and no follow-up period. Mild side effects included by very few of the patients included mild flatulence, gastroesophageal reflux, and dyspepsia. The second study was completed in 178 males and females aged 18 to 75 years with IBS based on the new Rome 4 criteria. For 8 weeks, participants were divided into one of 3 groups, receiving either 182 milligrams of small intestinal release peppermint oil capsule, 182 milligrams of ileocolonic release peppermint oil, or the placebo 3 times a day. There was a follow-up period of 6 months at the end of the study. Participants completed a daily abdominal rating scale, stool frequency and consistency questionnaire, and record of adverse effects. Also, a global relief of IBS symptoms, improvement in abdominal pain, quality of life, and safety of the peppermint oil capsule were assessed. Results found neither of the peppermint oil groups compared to the placebo experienced significant relief in abdominal pain or overall symptom relief. The small intestinal release peppermint oil group did, however, experience significantly reduced daily abdominal pain, discomfort, and IBS symptom severity. Limitations included limited generalizability, as it was completed on young participants of very similar race and ethnicity, and mild side effects including heartburn, gastroesophageal reflux, belching, and headache were reported by few of the patients. So overall, the study found that the small intestinal release peppermint oil had moderate effectiveness in IBS patients. The last study, a total of 60 males and females with a mean age of 36 and diagnosis of IBS were included. It was 8 weeks and participants were randomized to 187 milligrams of coppermint peppermint oil or a placebo capsule 3 times a day. Measurement tools included a researcher questionnaire that was asked by researchers to the participants. Questions measured severity of several IBS symptoms, such as abdominal pain and discomfort, stool consistency, urgency, and abdominal distension and bloating. A patient questionnaire was also included and included the rating of 6 IBS symptoms and assess general assessment of health and quality of life on a visual analog scale. The patients were asked to complete this questionnaire every night before bed on the first week, then weekly for the rest of the study duration. Another measurement tool used was the SF-36, which measured 10 domains, such as role limitation due to physical and emotional health, body pain, general health, vitality, and mental health as a result of IBS. Results found after 8 weeks, the patients on clopidogrel as compared to the placebo group showed statistically significant improvement in the SF-36 domains of bodily pain, general health, social functioning, and role limitations due to emotional problems. In addition, there was a statistically significant improvement in relief of abdominal pain and discomfort and quality of life reported by the peppermint oil group compared to the placebo. No improvements in diarrhea, constipation, or bloating were seen. Limitations included a small sample size, the questions were not validated, there was no follow-up period, and there was a 30% loss rate of participants from the beginning to the end of the study. Very minor adverse effects included headache, heartburn, and dizziness. When evaluating peppermint oil, there were mild adverse effects experienced by a few of the participants. The most common included gastroesophageal reflux, headache, and heartburn. However, it's also important to note that many of the patients, as they continued on in the trial, they noted that these adverse effects improved. Also, small intestinal release capsules are most effective and safer from these studies, as peppermint oil capsules released directly into the stomach have been associated with greater heartburn and nausea. There was, between all the symptoms, there was greatest relief in abdominal pain, and this was effective in doses from 180 to 187 milligrams. In addition, there's evidence of improved quality of life, which is very important to the patient. And concerns are future research needs to explore if there are long-term beneficial effects of peppermint oil and for how long these benefits last after stopping peppermint oil intake, as many of the studies that I looked at did not include a follow-up period. Overall, due to the varying symptoms each individual can have and the complexity of the several causes of IBS, no one therapy is going to solve IBS, so all therapies should be individualized and therapy success may differ between patients. Research has shown that both natural products talked about can provide symptom relief. However, it is still unclear which combination, species, and strain of probiotics is most effective in symptom relief. For peppermint oil, due to the safety and effectiveness, a small intestinal release capsule between 180 to 187 milligrams can provide relief, but mostly only in abdominal pain symptoms. Other therapies that have been studied include psyllium powder, which helps regulate the bowels and is beneficial with IBS. It may be beneficial with IBS-C and IBS-D. Prebiotics may help to reestablish the gut microbiome by replenishing the gut with beneficial bacteria. And since IBS can break down the lining of the small intestine, L-glutamine may help to heal the lining of the gut. Mind-body practices such as yoga, deep breathing, and acupuncture can calm down the autonomic nervous system, relax the inflamed gut, and lead to positive thoughts, relaxing the GI tract. Here are my references. Thank you for watching.